Good evening. A warm welcome to those attending and also to our viewers watching live on the Council's YouTube, Hillingdon, London. This is a meeting of the Social Care, Housing and Public Health Policy Overview Committee, and my name is Councillor Palmer and I am the chairman of this meeting. A key role of this committee is to monitor the performance of local public services within its remit and to hold in-depth reviews on topics of resident interest. We engage with a wide range of external witnesses in our activity, which can include community groups, residents and subject matter experts. Where we identify areas for change or improvement, we make recommendations to the decision-making cabinet. Details of the business to be considered today is shown on the agenda, copies of which are available in the room and also accessible on YouTube underneath the broadcast. For those present in the room and intending to speak, please note that you will be filmed and any statements you make will be recorded and made public. For those in the public gallery, good evening, you won't be on camera. A reminder to councillors, officers and those speaking today that you should turn the microphone button on when speaking. This will ensure you can be heard in the room and by those watching online. First, I'm going to go around the table and let me introduce the people present. Starting on my right, Councillor Duncan Flynn, Councillor Becky Hagger, Councillor Paula Rodriguez, Councillor Ian Edwards, Councillor Alan DeVille. We have our witness sessions, Heather Brown, Joanne Smith, Barbara McCauley, Vanessa Bonner, Angela Wegener, and our officers, Debbie Weller, Tony Zayman, Sandra Taylor, Zafar Zilkan, Councillor Janet Gardner and Councillor Tony Edgington. And on my left, even, not my right, my left is Anisha Teji, who is the Democratic Services Officer, and she is taking the minutes this evening. So after that rather lengthy start, we will now go on to the agenda. Agenda item 1, apologies for absence, please.
Apologies from Councillor Cooper.
Thank you. Agenda item 2, declarations of interest in matters before the meeting. Are there any? Councillor Edwards.
It's not really an interest, but I think just for the purpose of transparency, I should declare that both I and Angela Wegener are trustees of a local organisation, so we're fellow trustees.
Lovely, thank you. Any other declarations? Okay, agenda item 3 to receive the minutes of the 11th of April and the 9th of May, and these are pages 1 to 8 on your agenda. If we go through them, if there's anything anybody wants to say, page 1.
Yes.
Councillor Edgington.
Yes, to be consistent, we should have committee members present. It should be John Morse and then in brackets in place of Janet Gardner, to be consistent with Simon Arnold.
Thank you, that will be amended.
Thank you.
Page 2. Page 3. Page 4. Page 5.
Could I raise a point on page 5 as well, please?
Please do, Councillor Edgington.
There was a request for the Cabinet Member for Education and Children's Services to be invited. Was he? Could I ask?
He was invited and he sends his apologies. He has another meeting which was previously booked, which he has to attend. But we have Tony Zayman with us, who I'm sure will be able to answer any questions. So he was invited, but that is the answer.
Thank you.
Any other observations? Okay. Thank you. We'll go on to agenda item 4 then, just to confirm that the items of business marked as part 1 will be considered in public and the items part 2 will be considered in private. So for that, anybody watching, we do have a part 2 item today, so the camera will go off when we are discussing that. That will be discussed out of camera. We now go on to agenda item 5, which is our major review. We are 3/4 of the way through our review, and this is agenda item 5 on your papers, agenda item 9. We have 5 witnesses in front of us this evening, and I'd like to thank you all for taking the trouble to come. We have seen Heather Brown a couple of times before. It's nice to see you back, and this evening we have some other witnesses. I'm not sure how we want to take this. Who would like to go first?
We're quite happy to go first.
Lovely. So we're going to hear from Heather Brown, who is from the Citizens Advice Bureau. So thank you, Heather, and good evening to you.
Okay, has everybody got something that looks vaguely like that, but possibly in shades of grey? So this is what we're going to be talking our way through. Just to start off, I did give a detailed presentation on universal credit, I believe, in January. So I'm not repeating some of that information, but as most of you probably know, we're just over 2 months now into delivering a new help to claim service in the borough, which is to help people claiming universal credit up until the time of their first payment, but not beyond. So we are helping with submitting a claim, offering guidance through the digital service, budgeting help, signposting and referrals to debt advice, and signposting and referrals to housing advice. We've got 5 universal credit aids, and our supervisor is Joanna Smith to my right here, who's overseeing the service. Obviously it's early days, but we do have some statistics on the take-up. The service we're delivering is in the 2 job centres in the borough, the Uxbridge Job Centre and the Hayes Job Centre, 3 days a week. And it's also in the Uxbridge Citizens Advice Bureau and the Hayes Citizens Advice Bureau. And we're also providing telephone and web chat assistance with universal credit claims. Accessing the service, so far in the first 2 months, we've assisted over 250 claimants. Most of them appear to have been seen twice. It may go higher than that, particularly for complex cases once they start to be concluded, but this is the early information that we have. Most of them are being seen, 79% are being seen in person, and the phone is responsible for 24% of our contacts, and web chat, which is an entirely new thing for us, is coming in at 11%. So those are the main channels of access. You asked us specifically to talk about referrals to help to claim in Hillingdon, and as you'll see here, again, the majority are coming from the job centres, both through signposting and formal referrals. There's only been a handful of local authority referrals so far, but we'll talk a bit more about that later on. And some other agencies are referring. About 1 in 5 are coming to us through self-referral. The issues connected to universal credit that we've dealt with in the first 2 months of this year come to a total of over 1,600, and that is including not just help to claim but all our various projects. The debt advisors on different projects are also having to tackle universal credit issues, particularly those once the claim has gone into payment, because help to claim stops at that point. So it is turning into quite a significant part of our work. Moving on, something of interest which I only discovered today, we had a quick look at the client profile. Now, who is seeking help with their universal credit claims? I was surprised at just how distinctive the client profile is. I don't think we've run any other project or service open to the general public where the white UK take-up has been as low as this. Normally it's around 45%. With help to claim so far it's 27%. So there's massive take-up by black and ethnic minority residents in the borough. It's turning into a very, very big issue for them, particularly those with language issues as well. The proportion with disabilities is the same as for all our services over the last couple of years, which is just over 40%. So very distinct, and I think if anyone had done an equality impact assessment before universal credit went ahead, perhaps it would have given them pause for thought. I'm going to hand over to Joanna, who's supervising and has got the most frontline experience of the issues, and Barbara, who's our research and campaigns volunteer, will also chip in terms of, you asked us to address what are the top challenges or problems, and you'll see on this slide here, these are some of the ones which are absolutely top of our minds at the moment. So Joanna, if you'd like to flesh out some of those details.
Thank you. I'll talk...
Heather, excuse me, sorry to interrupt. Would you mind turning your microphone off?
Yes.
Just one microphone on at a time. Lovely, thank you so much. Thank you.
Hello, I manage a team of 5 UC aids, Universal Credit Aids, and I deal with more complex cases due to my experience as an advisor of many years. Our top challenges, first and mostly, is swift spiral into debt when legacy benefits stop and universal credit doesn't kick in for a while. Now, legacy benefits stop when person becomes, or when person claims universal credit. So they submit the claim and the automatic stop notice is sent to local authority to stop housing benefit, council tax reduction, and to other authorities to stop tax credits, for example. This decision is not evaluated by a human being. It's an automated process. And what happens when a person, further down the line, it transpires they are not entitled, they made a claim, but they've been found not eligible. Their legacy benefit stopped, universal credit does not go into payment. There is no safety net, there's no statutory or discretionary fund to help in those situations. This is one of the top issues that sends people into debt, rent arrears, council tax arrears, and has a huge impact on lives of whole families who become very quickly destitute because sometimes they are left only to survive on child benefit of sometimes £20 a week. Recovery rate of advance payments. So the government allows people to claim a kind of a loan against their first payment of universal credit. It's called advance payment. The claimant can claim up to 100% of their first payment. However, it then becomes recoverable at 40% rate. And those rates, when people sometimes also repay other older overpayments of other benefits, because then everything goes into repayment, couple of years old tax credits debts, quite, kind of ancient debts sometimes, people end up with just not enough money to live on. To remember, this benefit already is just for basic necessities. To cut it then sometimes to half, again, spiral of debt, not enough money, hugely increased number of food bank vouchers which are issued by our offices. The third point is habitual residency test. Now, our borough's demographic profile means that we have a lot of people who are not British citizens and a lot who are European citizens. This is 90% of my casework and my challenges to DWP is about decisions to decide that a person is not entitled to universal credit because they are found to be from abroad. Those are people who don't have the right to reside in UK and claim social security assistance. Vast majority of those decisions are challengeable and challenged. Vast majority of those decisions are very poorly made. I have brought here a sample of decisions which I later can give out, and this is just like a one-liner. You're not entitled. There's no reason. There's no explanation. It's very difficult to challenge such decision. And then if you challenge it, DWP doesn't have a deadline to respond. clients have lots of deadlines and they have to stick to them, otherwise they lose the claim, DWP can go on and on and on. I have clients who have settled status, which gives them unfettered access to social assistance, who have been refused universal credit because they don't have a right to reside and been waiting, now it's going on for 10 weeks for the DWP to respond. What happens again? Spiral of debt, food bank vouchers, sex work. So, whilst they're waiting, they are not getting any money. There's no provisions for people who might have perfect entitlement to benefit whilst they wait for DWP. And I know those decision makers are overworked. They keep going on strike because of the workload. And the clients bear the brunt of that. Another challenge that our clients face, because who we see are people who are not able to bash on their laptop. If you are okay and can pay for internet and you are digitally fairly savvy, we're not talking here about, digital excellency. You can bash out universal credit claim in 45 minutes, no problem. However, there are huge swathes of people who can't. Learning difficulties, elderly, mental health problems, all kinds of visual impairments, and it is extremely difficult for them to make and then manage and maintain this digital platform only claim. Okay, so it's okay, they come to us, we help them, we do everything for them, we note down for them the reminder of their password, because this is one of the top questions. I forgot my password. So we help, and they come to us. They can come again to us. Okay, they can go once to the library, and so on. If library is kind of with it. But then you have to maintain it for months and months. So who do you ask? Your 11-year-old kid, frequently. What if you don't have anyone? What if your husband? It is extremely difficult to persuade DWP call handlers to open a non-digital claim. Non-digital claim, there is an option of claiming universal credit on phone. Okay? But if you claim on a phone, for example, you don't get decisions in writing. You don't get letters. Because normally you would open your universal credit account and you would see all the decisions. But if you're doing it on a phone, that's it. No letters. And it's very difficult. The other day I spent 45 minutes negotiating with a call handler for a person who is housebound. Okay? DWP in their policy initially promised home visits. Disappeared. They will go to home or hospital, but only to check the ID documents, the passport and scan bank statements, whatever. But to start the claim, you're on your own. And if you're housebound, and if you have learning difficulties, and if you have no one. So that's my experience so far. Once we put a client on the claim and they can manage, it's a huge milestone, to get over for a quite significant number of people. Thank you.
Thank you. This is obviously going to be, this is what we've been hearing all the way along, and I thank you, both of you, for being honest about what you've got to say, because that is what this committee welcomes, the honesty and transparency. I should have said before, we've got about an hour really for our witness session, but I don't want to stop anyone having the opportunity to talk. So I'm going to ask, but I think it's Barbara wants to speak next. Would I be right?
Been involved in preparing the evidence for the committee to consider.
Okay.
I could just Okay, just picking up or taking on from what Joanna said, you asked us to think about urgent improvements or suggest improvements and changes, and we certainly could come up with a very long list, but just coming up with 7 items which we think need urgent action. Top of the list is action to reduce the impact on debt. That might encompass a variety of things, but the impact is massive and it's affecting, for example, the Hayes CAB immediately in a very serious way. Easier access to the non-digital route. The process to get accepted on it is absolutely staggering. We need resolution of the habitual residence test issue once and for all. I have spoken at another meeting of the Hillingdon Council's Universal Credit Working Group where there seemed to be general agreement with if someone has already passed it on the legacy benefits, they should just be passported straight over. There really shouldn't be this issue happening at all. We need resolution of something we're referring to as the claims carousel, which Joanna knows more about than me. But in desperation, residents are opening up 2, 3, 4 claims, and that's creating a lot of difficulty. There needs to be either you revert and reopen the one that DWP has closed or whatever, and they're not getting sensible decisions as a result of all this, so it's adding to the confusion. Really, really need faster and better quality decision making. It hugely varies, and our job is obviously to help clients with their appeals. We've got to identify what the grounds are for asking for a mandatory reconsideration and then an appeal, and if you've got a one-liner saying you have failed, it doesn't give us an awful lot to go on. As Joanna said, we need deadlines on the DWP because every week that things go on, you've got a family subsisting on next to nothing. We need payments while people are waiting for their mandatory reconsideration decisions. Those of you who are familiar with employment and support allowance will be aware that payments are reinstated or made while people are waiting for the outcome of their mandatory reconsiderations. But with universal credit, people are living on sometimes absolutely nothing or next to nothing while the DWP takes its time to come to a conclusion. So those are our main points. No doubt there are more, but those are the ones which are top of our agenda.
Thank you. Before I go to questions, we did invite the DWP here today, and as we did for Hillingdon Mines, and unfortunately the worker from Hillingdon Mines is unable to attend due to illness, otherwise he would have been here. But the DWP, it's another reason, and I feel that I'm going to read that out now because a lot of the things that are coming up are DWP related and we can't answer them because we don't have anybody here. So I'm going to read out what was said. So we asked the DWP manager to be here. We've met with him before. Some of us have been to visit the DWP to see how it works there. And so today the statement is, thank you. Further to our telephone conversation today, please see our statement below. Thank you for the invitation to attend the Hillingdon Social Care Housing and POC meeting. Unfortunately, we are unable to attend as we would not normally take part in a meeting that would be broadcast. However, we will respond to your questions by early next week. We are more than happy to meet separately with the committee at a future and address any concerns raised. Our apologies for any inconvenience this may cause. Further to that, they have sent a rather lengthy paper which they have requested that I read out. I am going to make the decision that I am not going to read it out. It is too lengthy and we have witnesses from Dash which we haven't heard at all from, and I think that has to take priority because they are not DWP are not here to answer any queries we have. going on from that, we received an email today from the DWP asking to meet with me as chairman away from the meeting. In transparency, I am bringing that before the committee, and my view is I am not prepared to do that. This has to be open and transparent. I am not prepared to sit and meet with people and not have it recorded and not give people the opportunity to have their questions addressed clearly, which I think I've said all along that this review has to be open and transparent, and any recommendations we make have to be fair. And I am not prepared to sit out of camera and have that done. So I'm asking the committee whether you agree with what I'm saying on that, and I'm going to say no to meeting.
So could I ask, could a copy of the letter or the email be distributed to members, if you aren't going to read it?
Certainly. I mean, I'm not going to hold on to this, and I'm not saying I'm keeping it, but so it will be distributed out of fairness to the DWP. They have responded to it, and so you should see it, but I'm just not prepared to meet with them and discuss it on a one-to-one basis. I find that not acceptable. So thank you for the support of the committee, and we will go on this evening with the witness session, and it saddens me that the DWP are not here to answer questions clearly. As a government organisation, they should be sitting here and answering the questions, but we can't make them. It's a voluntary thing, and they choose not to be here. So I'm not quite sure. Were you happy if we answer some questions now? Is that okay? Do members have any questions for Joanne and Heather? Hagar.
Yes, thank you, Chair. Thank you, ladies. A really good report again. It's always a pleasure when we hear it, although it's not, it's not good news. It is very worrying, and I've got two questions actually I'd like to ask. Right at the beginning, we've seen there's been an issue with universal credit. Do you think there is anything else we can do to actually make it clearer? Now, when I mean clearer, I mean in the sense that when people do apply for universal credit, as you just mentioned, Joanna, a lot of their things stop, so rent, the housing. And I think some people, when they do fill it out, maybe aren't aware, or with a disability, they don't actually understand when they're doing it. So they're put in, I completely agree with what you said, they're put in to arrears straight away without really knowing until they find they haven't got any money at that month. As far as I'm aware, there's no advance warning that they don't have any money. It just literally isn't there. So the question is, can we make it any clearer for them before they fill out the universal credit form?
Okay, so there is a lot of information available. Okay, there is a government website, Citizens Advice, and other charities put it excellent. However, it is an information overload. Okay, and the information that your legacy benefits stop get missed, because there is a kind of, it first starts, this new benefit replaces this, and these are your payments, and this is what, so I cannot see the way to condense it any further for a client to be alerted to everything. However, in such complex circumstances, the onus for client to know everything, it shouldn't be on the client, the onus, okay? There should be also warning whilst you are making an application or whilst you're being advised, because loads of people are shocked, okay? Loads of people are shocked that they are not getting tax credits anymore. They are not getting housing benefits anymore. So, to be fair, from the local government, from the local authority, from Hillingdon, the letter comes. It's clear, explains everything that's happening, okay? But people are still, you have to be really on the ball to understand it, to know, to expect. So, in answer to your question, yes, we could try, but there's such a amount of information and such a major changes that people are just not taking in. And the decision to stop the legacy benefits shouldn't be made by a robot, shouldn't be made by a computer, should be made by a decision maker to say, yes, this person is definitely entitled. The legislation provides for it. The legislation says very clearly, okay, you are entitled to universal credit, so your legacy stops. If you're found not entitled to universal credit, you can keep your legacy. Legislation is very clear. However, it has been automated to the point that this major issue has been created.
Yes, thank you, Joanna. Can I ask my second question?
Could you just hold off that,
Yeah,
because I've got two other members
Yeah.
who want questions, and then if there's no more, I'll come back to you. Councillor Gardner, please.
Hi. What I was going to ask, would there be any benefit of having actually, it's a shame that the DWP officer isn't here. Would there be any benefit in having a DWP member of staff working one day a week at the one-stop shop? And the reason I say that is because you know as well as I do that when I'm there and if something comes up that I can't deal with it, I'll ping them over to who's from the contact centre, which is 2 days a week. I thought because the atmosphere in the one-stop shop is a lot nicer than it is at the DWP or even at the main civic centre, I thought it would be quite good. I mean, I was going to say, if Interpol was here, would he benefit from that? Would you appreciate that if we could somehow wangle it?
I would absolutely love it. I think that actually working at the coalface helps the relationship grow, helps to see each other problems, because I don't doubt that the job centre staff people are, encountering a variety of issues. And yes, I'd love that. Bearing a resolution comes to space and room and desk to work for, but in theory, I think that would be an excellent idea, because at the moment, the cooperation needs to grow a little bit more.
Councillor Flynn.
First of all, I think we need to acknowledge that there will be a group of people who, however much we empower, they are just not going to go digital. Okay, so there is this small group of people, for whatever reason, they just are never going to be able to, apply this digital platform. Okay. The second issue is why so many people come to face-to-face appointment. I think that there is a group of people we obviously don't see because no one comes to us to say, hi, I've done universal credit, fine. I'm just, we're getting people who have difficulties. At the moment, the way the universal credit application process is designed, I am welfare advisor of 20 years, I have never seen a complicated mess like this. I cannot envisage at the moment, however positive I'm trying to be, the changes that would be implemented to make this whole benefit easy. It combined a lot of elements. It treats people differently if they are self-employed, employed, getting paid weekly, fortnight. It's a mess. But I think there is an issue also of resources from the government, from the DWP, to help people. Because if there is so many that needs this face-to-face, we need to be able to provide it. Otherwise, the government seems to be accidentally denying, because I have clients who are so anxious about this application process. They don't know, oh no, I can't, I really am scared. They come with debt, they come because they are in rent arrears, but they are so scared. Yes, there is quite a lot of negative, true, but negative information in the press and media, and people are obviously anxious, but it's coming from, based on facts and statistics. So, your question was, how can we make it easier so that so many people... I'm sorry, I would need to be a genius to give you kind of...
So I appreciate the hard question.
Yes, it is very hard to kind of... Heather, maybe you have...
The government, I think, realised a little bit belatedly what a massive issue this was turning into, and therefore it's funded the Help to Claim service for 1 year. We don't know what's happening thereafter, but the problems aren't really going away. The more you have targeted, means-tested benefits, the more complex systems are going to be, as opposed to sort of universal entitlements, which are becoming mostly historic. So it's difficult to see how it can be simplified. I think the only response so far has been to put the support in, and we're very happy to be providing that support. We just have to hope there's enough of it, and it goes on long enough, or as long as claimants actually need it.
And the remit is very small.
Yeah, the remit. I mean, this. I should just say, I know I said it in January. Obviously, we were delighted to know that the Help to Claim service was going to be set up. But it wasn't the answer to our prayers, in that as soon as universal credit goes into payment, we have to stop assisting people under that, and yet the problems don't go away. Someone's got to maintain the claim thereafter. Lots of other things happen. The debt advice needs to be delivered. So perhaps one step forward would be to look at the medium-term support needs. People's support needs don't end the moment they get their first payment, and that is perhaps something which is realistic to hope might be reviewed.
Thank you very much. I don't want to cut this short, but I hear what's being said, and what the remit of this committee is. We are where we are with the government decision. What we're looking at is how we can make the best of this for our residents. So I want people to understand, if anybody is watching or whatever, that our remit is not to sort out things beyond our control, but what we are hearing, we will be putting in a report and making recommendations to make sure that our residents are best served by what is going on, and albeit being quite difficult, but we are hearing themes all the way through this review, and those themes will be reflected in the report, and that is the internet, the mental health issues, and that sort of thing. So if anybody is watching, please wait for the report. It will be online, and you will be able to read it when we come to it. I'm anxious that we have another witness session to hear. So I would like to acknowledge the case histories, because I think that has been very, very useful to see those anonymised case histories that we have before us, and that is certainly something that I think we will be looking at in the recommendations, because the theme of that is what you've been talking to us about, you know, the assessments. Goodness knows how you can appeal a one-line assessment. I mean, it's just, it's beyond belief. There's nothing there to grasp. You need something to argue, and if if something is right, it should say why it's right. So that is something that I feel your pain, I suppose, really, and the pain of the residents who are suffering and going into debt because of that. So that, that's something that hopefully we can bring up with the DWP in the future in our working parties. Yes, Joanne.
Just very, very quickly. On the local ground, I forgot to mention before that we sometimes, I know that there are lots of provisions to help people to upskill or get the training for IT skills, and there are kind of excellent patchy provision, and we would love to work together or ask for help in creating a data bank of resources, because Harrow College provides something, library provides something, and it's kind of, there is no database of resources where we can refer clients or where people can easily find, where can I get my basic IT trainings because I've never been on a computer. So that's kind of another comment.
Thank you very much. Are we happy that we move on to the next witness session? Is that okay with everybody? Thank you. In which case, welcome to Angela Wegener and Vanessa Bonner from DASH. You've heard what we're talking about now, and please feel free to be as honest as you like before this committee. I've said it so many times, but we have to hear how it is in the voluntary sector, and welcome today, and I'm not sure which one of you would like to start, but please go for it.
Thank you. Thank you for inviting us. For those of you who don't know, DASH, we work with disabled people, and that includes people with learning disabilities, physical sensory disabilities, and some mental health. We are coming at this from a slightly different perspective, because our big problems start after the CAB finish. A lot of our clients can't read and write, let alone be computer literate. They literally can't read and write. So they then have this lack of ability to actually go in and do what they have to do, and there's nobody to support them at that point. Many of them don't have regular access to the internet. They don't have a computer at home. They just don't understand what it's all about. They find it very, very difficult. They often need support when they're going for appointments. Some of them are very uncomfortable going and meeting somebody official, particularly people with learning disabilities. I'm sure Sandra will understand. The whole online thing is very, very difficult. The other problem is home visits. There are people who literally can't get out, and they do need to have support at home. Excuse me, I lose my voice easily. Some of the common problems that we have, I suppose that the big problem is just this total lack of understanding. And I think the best way to demonstrate that is if Vanessa gives some actual case studies, if that's okay.
Cool. Okay. So, I have one particular client that I've been supporting for quite a few months with his claim. He's got multiple needs, multiple disabilities, and he's needed support right the way through the process. His claim is still ongoing and it's not finalised, and so far it's taken over 30 hours of support to get him to the point where at least he has got some of his benefit in payment, and his rent and everything is being sorted, and his council tax relief. But he is going to need ongoing support for the life of his claim, which is a huge amount of time.
And I suppose what needs to be addressed also is, if you just wouldn't mind switching your mic off for a sec, Thank you so much. What needs to be addressed and what we are, I suppose, struggling to put down on paper is the impact on people's mental health. Both the workers that are doing the work, because I think that mustn't go unnoticed, that you know, we're hearing on both sides, 30 hours trying to appeal something of a one-line sentence. That is, you know, I've worked at CAB, I understand, I've worked in information and advice. It's a really difficult job, and what we're hearing is the unmet, we can't quantify people's mental health there, but to think of these people without, and somehow we have to put that, you know, we have to put that in the report, and I'm not sure how we do that, but I think, you know, I need to say that this sort of thing will be impacting on people's mental health.
There is a massive amount of stress. I mean, people come to us and they're literally shaking. They're so frightened of the whole process. And that's why we often have to go with people and sit with them when they're going through this whole thing. But I would say the impact on their mental health is huge. You've got some more to say?
Yeah, I think it is, and it's not just the changes to their benefits, but it's support to deal with all the other changes that come as a result. It's dealing with the landlords, it's dealing with the council tax relief, things like how do they prove their entitlement to free prescriptions, because it's all totally different. So it's encompassing everything.
Could I just ask you about the home visit, because you've both touched on it, and I've heard from the Citizens Advice Bureau that they come out, the DWP come out to check the documents. Is that your understanding of it, or do they come out to do a home visit to do a full assistance package, for want of a better word?
I'm not sure is the honest answer to that. I mean, there is the home visiting team, isn't there, from the Department for Work and Pensions.
Yes, but they are limited just to the ID check. We had a confirmation from the job centre who confirmed to us by email that this is the situation, that the home visiting team will come out, but just to verify the ID. They will not start a claim for people even who are housebound.
Okay, so that I have to say that is contrary to what the committee has heard. The committee visited and were assured that home visits are taking place, and we were led, unless people on my left and right are going to correct me on that, we were led to believe that that was a active service that was successful. So clearly there's an issue there that is not quite struggling to find a word. We're hearing disparity for not for the first time. No disrespect to those of you sitting in front of me, that's not where I believe the disparity is. Would you like to continue, Angela and Vanessa?
Okay. So, I mean, the number of referrals we've had are quite small at present, only about 10 or 11, but that's because they are the more complex cases that really need one-to-one support. A number of those have come directly from social workers, also clients that are already known to us and trust us, and also, I think, Bell Farm as well.
Most of them are because they can't use a computer, or because, as I say, they can't read and write. And there's also, particularly with people with learning disabilities, an amount of trust that you have to build up with people when you're working with them. And so they come to us because they trust us and they know us, and they know that we understand them, and we will take a lot more time. The thing is that where you explain something to someone with a learning disability, you often have to do it 3 or 4 times, have several visits, and not spend too long with them all at one time. But I think otherwise, I mean, I think, realistically, we see when we get to the migration, so it's going to be huge. We're going to have so many people coming and needing our help. And we're not, it's on top of the day job with all the other benefits advice that we're giving.
Thank you. Are you happy to take some questions from us? Thank you.
Thank you. It's quite a simple question. Is the additional burden that is being placed on your organisation as a consequence of universal credit, are you receiving any additional funding from anybody to enable you to provide that support?
Short answer, no.
Councillor Gardner.
Something that I've heard from both lots of speakers is the word trust. People come to you because they trust you. People do not go to the DWP because they don't trust them. I have people coming to see me for a variety of different things. I mean, I've acted as an advocate for somebody on who was applying for PIP. They came to me because they didn't trust somebody from the DWP to speak to. I mean, is there anything we can do as a committee or as individuals? I don't know. How we can, it's almost like, how can we enforce or make the DWP be more user-friendly? I appreciate that they have heavy-duty workload, I understand that, but a lot of the people that are, I mean, from your organisation and your organisation are volunteers. The people at DWP are paid. So I'm trying to work out, there's something wrong somewhere, if it makes sense to say. You keep, both of you have mentioned trust on several occasions, and that worries me. People come to see you because they trust you, because they don't trust the DWP. People come to see you because they trust you, they don't trust the DWP. What can we do?
Just a tiny point I want to make in response to that. I was quite staggered to hear from one of my staff members that a staff member at the local job centre was wearing a UKIP badge at work saying to people, well, you know what I think, and this is not how you build trust. I was so staggered at this lack of professionalism. I mean, in the CAB service, everybody's trained in week one that you leave your own personal views, biases, whatever behind. Nobody turns up at CAB wearing a badge of any sort whatsoever, advertising their views. Maybe, just that lack of professionalism. It's just one tiny example, but it really shouldn't be happening.
No, and I think, we acknowledge that the voluntary sector is a support to the statutory sector, and in Hillingdon we're very, very proud of the voluntary sector, and the fact that, people come to the voluntary sector and this voluntary sector is trustworthy is of credit to this borough and every agency that sits before us. And yes, I mean, it's entirely improper, and wearing badges like that, what would you expect? It's a management issue, and sadly there's many things that this committee can't do, but we will do our best to represent what is coming before us, and I have to say I'm appalled at that. I
would just say that it's not just about trust. It's, to some extent, there is a sort of a feeling that people are out to catch them out, and particularly with some of the very vulnerable people that we work with, they are just frightened. They're just frightened by going to see people in authority who they think are going to try and catch them out. And so that's why we're very keen on actually going with people when they go for assessments and things, because to have a friendly face with them and to know that they feel more comfortable, they will actually come out far more and will engage much more.
Thank you. Councillor Hagger.
Yes, thank you, Chair. And one of the things that really is striking out to me is just actually understanding disability and understanding what it actually means. In many different formats to people. And a question I'd like to ask really is whether you think it would be beneficial that DWP actually has some training on the types of disability that they're going to be having, and people that are going to be coming in, from learning disability to physical disability to mental disability, because I think this is the big problem here, is that there is not enough stepping back and actually looking at the person and what they can actually take on board in their capacity mentally.
I mean, we have heard
Sorry.
that the DWP have said they've been trained on mental health. We have heard that in a witness session, so I mean, I can't say whether they have been trained on anything else, but one would hope that they do have some level of training. Angela?
We had a situation once where somebody went in and were asked their name and address, and they were having real difficulty communicating. And the answer was, well, if you can't even tell me your name and address, disability awareness training is absolutely vital, yeah.
Councillor Flynn?
As Heather mentioned before, we have UC aides working from outreach in the job centres. The personal relationships they develop with individual job centre staff colleagues this is very helpful, and it leads very often to swift resolutions to issues that otherwise would take weeks, if not months, if done by letter. So this is working well. We're not entirely sure yet whether this is a super efficient use of those precious resources, like people working from job centres, because sometimes they don't see a lot of clients for a variety of reasons. But when they are there on Mondays, Wednesdays and Fridays, both in Hayes and Uxbridge Job Centre, and made, good working relationship with colleagues, that is excellent. That should really grow and spread to organisation. Yeah.
I'll just add to that. I was at a Pan-London meeting of the Citizens Advice Service a week ago, and it was about 50-50 around the table, those who felt they had very good working relationships with the job centres and those that didn't. So it clearly can be achieved. I think of those that said it was working relatively well, they'd had a pre-existing close relationship with the job centres before universal credit really became a factor in their borough. The other thing I'd mention from a national conference I went to a year ago is that, yes, in terms of is it all doom and gloom or not, there was at least one person there who said, they occasionally they come across a younger person who is IT literate who quite likes managing their claim online. So, but obviously they're not the ones that are going to be coming through our doors very often.
Does anybody have any more questions? Joanne, you want to say something else?
I just wanted to return to the issue of disability and job centre colleagues training. We had to resort to sending clients out with a pro forma letter saying, I've got complex needs, I need help. This is just to prevent people falling into sanctions or claims being stopped. The job centre has their own complex need plan. We were not made kind of party to that, but we know that they are obliged to have one, and we are kind of furnishing clients with that to have it scanned on a system. Sometimes, because it's not kind of government branded paper, they are met with resistance, but it is something to at least alert the authorities that there's a problem there might be.
How easy has it been to track that? If you're sending a client along with that, how have you been able to track how that has been successful? I hear you saying that they don't always accept it because it's not on branded paper. If you have a client who's not able for one reason or the other to advocate for themselves, how difficult is that to track the success of that?
I might need to update you in about a month. This is very new. This is something that we felt we have to start because people with variety of disabilities were not assisted properly.
Thank you. I mean, I think that's quite a good piece of evidence work there. I mean, that may be something that can be used across the voluntary sector. I mean, I'm sort of quite keen on things being similar from organisation to organisation, so we're not reinventing the wheel. And that may be something that organisations from the voluntary sector can all use, whilst, you know, if they're given one thing that says virtually the same thing but from a different angle, that may be quite useful. Does anybody else have any more questions for our witnesses? Okay, well then I just need to thank you all so very much for giving up your time. This has been probably one of the most difficult reviews I think we've done. I mean, this committee is newly formed, and I've been on other committees, and this is very, very difficult because we're faced with a lot of things that we can't actually change, but what we are hell-bent on is making sure that we hear what's been said and we do our very best to make recommendations to the Cabinet for the benefit of our residents going forward. So thank you for your honesty. We will, when we've done the report, we will make sure that each and every one of the witnesses sees a copy of that report, and if any of you have anything that you want to add to that, please email. And I can't thank you all enough for coming. That's absolutely fantastic. Please feel free to leave.
Thank you.
Have a lovely evening, and thank you very much. For those of us still seated, we are now going on to agenda item 6, which is the Corporate Parenting Panel draft minutes, pages 13 to 20, if my eyes don't deceive me, on the agenda. These are really just for information. Obviously, we weren't there, other than Councillor Edgington, who was there, so we're not really in a position to comment on those, but Councillor Edgington has his hand raised. Please, you may ask your question.
Thank you very much. It was very just really a note on page 18 of the agenda, the draft minutes. It talks about an example PEP being circulated to members. I haven't seen that, I don't think. So I wonder whether that could. And it'd be useful to circulate it to all members of this committee as well, I think.
Yes, okay, that's, I see no reason why that can't be done. So just to say to people that we will be getting these minutes on a regular basis now. This is what this Policy Overview Committee does. We oversee the work of the Corporate Parenting Panel, and Councillor Edgington is on both of those. So
could I just make another point as well, if I may? I asked a question of officers about the sufficiency strategy, which is mentioned in those minutes. Sufficiency strategy is to try and ensure that there's enough provision within the borough for children in care with children in care who've got particular needs. And I haven't had a copy of that information. And I spoke or sent an email to Lloyd White, Head of Democratic Services, about it, and he agreed that I should have had a response to that, and in the absence there should have been a notice given to this committee. I don't know whether it has been under the regulations.
I'm not sure, and I suppose what we can't get caught up in here is crossover from one work to the other. This is an overseeing panel. I can't get into what should and shouldn't have been done on the corporate parenting. I think you will have to go back to the corporate parenting panel and ask through the correct you will have to go through your chairman, Councillor O'Brien, or go to Democratic Services, whichever is the correct way, I think, Councillor Edgington. I hear what you're saying. If you should have had something and it's minuted that you should have had it, yes, you should, but what this POC can't do is do that, I'm afraid.
Okay.
Thank you.
Thank you.
Is everybody happy that we move on to the next agenda item? Thank you. And as soon as I've got my agenda item before me, I'll tell you what that is. It's agenda item 7, the forward plan, which is for noting. Unless there are any comments, Councillor Edgington.
Sorry. There are 2 items on here which are not on the agenda for Cabinet next week. One is quite important, and that is the new children's safeguarding arrangements in Hillingdon. Now, I think from what I remember, I may be wrong, is that the local safeguarding children's safeguarding board ceased to operate in March, and new arrangements need to be set up. And I don't know what is happening, and I don't know whether anybody else here would be able to answer that point, please.
It's on the 31st of July, I understand, Councillor Edgington, is the update.
That's the update for last year. That's the annual report for the year to 31st of March 2019. But I seem to recall that the board ceased at that point when we had the presentation. And then you have to be new safeguarding arrangements, which is why it was on the agenda on the forward plan for Cabinet this month, next week. But it seems not to be on the agenda anymore. And I'm not sure what the safeguarding arrangements are.
Okay, well, we'll have to get back to you on that one. I'm afraid I can't come up with that answer off the top of my head unless any officer in the room, Councillor, I was nearly calling you Councillor Stamen. I think, have I promoted you or demoted you? I'm not sure. I'm going to call you Tony. Tony, would you like to answer that?
I can't get over the power that's gone to my head after that introduction. 2 points, if I may. So the matter about the Cabinet paper is with the relevant Cabinet member, and I can't sort of comment any further on that. However, the existing arrangements do continue through until September, so there isn't a gap. So if anything between now and then happens, there's the existing chair is still retained in order to pick that up.
Thank you.
Thank you, Mr. Zeman. Back to normality resumed. Is there anything else anybody wants to say on that, or can we go on to the work programme? Let's go on to the work programme. Any comments? Are we happy with the work programme? In which case, that's going to end now, and in a minute we will be going on to part 2, but we won't be going on until I hear from my